we want to talk about Omicron again. So is Omicron dangerous? Actually, I have catered a few reports from all over the world, the scientists, even the doctors, okay, even some association. Okay, first report from WHO states that Omicron has less severe than Delta, but still poses danger for unvaccinated. I still explain in English. So in case you have any Malay friends or any others English educated friends, you can use this, share with them in this slide also. Okay, so from WHO, saying Omicron less severe than Delta, but still poses danger for unvaccinated people. Okay, and also report from Danish experts saying Omicron is between 2 and 4 times more contagious than Delta. Okay, and from CDC. CDC is the Centers for Disease Control and Prevention in US. Okay, stated that the Omicron variant spreads more easily than the original virus that causes Delta and COVID-19. And CDC experts saying that anyone with Omicron infection can spread the virus to others even if they are vaccinated or don't have any symptoms. Meaning if you have infected before or you have taken your vaccine, also you have the chance to get infected with Omicron. So do you think it's dangerous? There's a doctor from Canada explained that the reason why Omicron spreads so fast in human body is because they are developing a new variant. So this new variant Omicron already existed in more than 10 countries in the world. Okay, then they named the new Omicron variant as BA2. So the Omicron that we are facing now is BA1. And new Omicron already existing in this world. They call it as Omicron BA2. And it spread faster than Omicron BA1. Okay, let's look at the symptoms, the common symptoms if you are already vaccinated. Okay, you may have only sore throat, runny nose, continue sneezing, cough, headache, muscle pain, or nausea. Okay. Then let's come to the Omicron infection timeline. Meaning if you have infected with Omicron today, okay, you won't feel anything until after day 2. Then the symptoms start to appear. So the best time to test your PCR is the between day 4 and day 6. And the symptoms will slowly go off after day 9, meaning you would have fully recovered after day 12. So let's compare. Okay, let me minimize. Okay, let's compare the symptoms between COVID-19, Delta, and Omicron. You can see Omicron has actually a wide range of symptoms, but yet the symptoms are very different from one another. It is mostly due to the vaccination or the immunity acquired from the previous infection, because some people already infected with COVID-19 before. So when they build up the immunity, they have mild symptoms. Okay, so let's look at COVID-19. Symptoms for COVID-19, including weak muscle pain, shortness of breath, focus difficulty. Can you hear me? Is it hang? Can you hear me? Yes, right?
Can hear.
Okay, then you may feel fatigue, headache, sleeping disorder, anxiety, memory problems, dizziness. Okay, come to Delta. The symptoms including fever, cough, sore throat, runny nose, breathing difficulty. And come to variant, you see the range are wider. Running nose, headache, fatigue, sneezing, sore throat. Oh, sorry. Sore throat, persistent cough, hoarse voice, mosang, okay, shivering, fever, dizziness, brain fog, abnormal sense of smell, sore eyes, unusual muscle soreness, loss of appetite, loss of smell, chest pain, swollen glands, and even depression. Okay, But talking about spreading power, you can see Delta has greater spreading power than COVID-19, and Omicron can spread faster than Delta. So what about vaccine? Can vaccine protect us? Yes, definitely. Look at COVID-19. Immune protection increased after you take 2 doses of vaccine, and it will decrease the risk of severe illness and death. So for Delta, if you have taken 1 dose of vaccine, the protection will go up to 33%. If you have taken 2 doses of vaccine, the protection will go up to 88%. Very clear. Come to Omicron. For those who have been vaccinated with 2 doses of vaccine, it is recommended to go for your booster. So how to prevent Omicron? Here are some recommendations. Okay, first, to practice at least 1 meter social distancing. I believe everyone do so. And wash your hands frequently and wear your mask when you meet people. Use tissue when coughing or sneezing or covered by bent elbows. But be frank, I personally don't encourage you to cover your mouth with bent elbows because Omicron survives in the air, and also it survives in droplets. So if so happen your elbow or your shirt got Omicron virus, so when you cover by using your elbow, you tend to expose yourself in the risk. So please use tissue when coughing or sneezing, and throw away your tissue immediately after use. And avoid poor ventilated or crowded spaces. Educate your children to inform parents or teachers promptly, immediately when they are not feeling well. Or if you are not feeling well, also please stay home. So is Omicron dangerous? Some of you may think it is not dangerous because the symptoms seems not life-threatening, but certain people will still take it seriously due to weak immunity. So what is immunity? What is immune systems? Okay, as everyone knows, there is no medicine to cure COVID. There is no medicine to cure Delta or Omicron. The only thing that you can help yourself is to build up your own immune system. So what is immune system? Let's look at it. The immune system is one of the amazing system in your body which can help you to kill or to combat with virus. So this immune system come with 3 lines of defense. Okay, let's talk about the first line of defense. Your skin. Your skin acts as a protection for your body structure, and you can try to taste your skin. It tastes a little bit soury because your skin tends to have a little bit acidity. The acidity is actually to kill the germs and to kill the bacteria. So next, mucus. We have mucus in our nose, we have mucus in our ears. It's actually to filter the germs, the airborne bacteria. And come to cilia. Cilia meaning small hair, the tiny hair all over of our body. Okay, the cilia in our nose also to filter the airborne bacteria, as well as our ears. The cilia inside our ears also the same thing, to filter the airborne bacteria or the germs. Come to a stomach acid. Stomach acid not only to break down our food, but also to kill the germs. Okay, and urine flow. When we pass urine, when we pass motion, it also get the bacteria, the germs out from our body. It acts as a detoxification in our body as well. Okay, come to second line of defense. Now you can see a lot different immune cell. The function of this immune cell is to combat, is to kill the germs, the bacteria or foreign objects when they attack our body. Okay, come to the third line of defense. T cells, B cells. Okay, they have CD4, CD8, different kind of T cells and B cells. But basically, these T cells and B cells are hibernating. They are not active. Okay, they are not active, so we need vaccine to stimulate them. We need vaccine to activate them. And when they activated, then they will combat with the so-called virus. And after they fight against with the virus, they will remember the virus. So it will come out and kill the virus automatically in the future when we get infected again. So sorry, is my dog very noisy? Can I hang on for a while? I need to settle him.
Okay, Dr. Amie.
So sorry about that. So sorry about that. So sorry. Okay, done. So another system, another amazing system in our body, okay, is detoxification. So now you can see microbiome. So what is microbiome? We have microbiome in all over our body. So microbiome, for easy understanding, you can imagine microbiome is good bacteria, and good bacteria help us to kill bad bacteria. Okay, so it acts also an important part in our detoxification system, and this detoxification system also consider part of our immune system. So after we know that, so you know what to eat for to build up your good bacteria in your body. So definitely CellAge Plus. Okay, so now we know immune system, we know immune cell, we know T cells, we know B cells is the our immune cells to fight against virus. So now we need to ask ourselves, do I have enough quantity of T cells and B cells? Do I have the quality, the good quality of T cells and B cells? So what we can do is to build up. Okay, now we need to understand, where can I build up my T and B cells? How do I build up my immune cells? Okay, first of all, we need to understand immune cells, T cells and B cells are produced by our white blood cells. And our white blood cells are produced by our hematopoietic stem cells hidden in our bone marrow. So the problem is hematopoietic stem cells are hibernating. They are sleeping. They are not active because we are aging. Okay, due to aging, our hematopoietic stem cells all are hibernating. So now we need to do is to activate our hematopoietic stem cells, so that hematopoietic stem cells able to produce white blood cells, and white blood cells able to produce our immune cells. So what to do? CellAge Plus. Here, I want to share with everybody about CellAge Plus. I believe Kakilang all we know CellAge Plus. Yeah. So again, CellAge Plus is not a chemical product. CellAge Plus is not a drug. CellAge Plus is not invasive and is not expensive. It is only natural plant-based product. And again, it is affordable. Because CellAge Plus contain abscisic acid, short form ABA. So what is so wonderful about ABA? Okay, ABA is substance of plant, and this ABA has been found able to stimulate our stem cells in our body, including both hematopoietic stem cell and mesenchymal stem cell. After the hematopoietic stem cell being activated, it will be able to produce the immune cells for our body, is what I want at the moment. Okay, so see how it works. Look at the picture on the left. It is stem cells. Okay, and look at the picture in the middle. The stem cell being activated by the ABA. Because when we consume ABA, when we consume CellAge Plus, the ABA in CellAge Plus will be able to activate our stem cells and cross-talk with the ABA inside our stem cells. Yes, our stem cell contains ABA as well. So when ABA talk to ABA, they will activate, they will awaken the stem cell in our body. And eventually, the stem cell will be able to produce more stem cell. We call it as proliferating. So this is a proven clinical research showing CellAge Plus formula not only awaken hibernating stem cell, but it also increased the stem cell growth by 4 times in only 5 hours. And it will continue to grow up to 60 days. So here we feel proud for our researcher and formulator, Dr. Anstill and Dr. Mark. So who is Dr. Anstill? Dr. Anstill is one of the first scientists in the world to treat heart disease or heart transplantation with stem cells. So after she successfully treated heart disease by using stem cell, she then thought of an idea to prolong the life of stem cells. So in order to prolong the lifespan of stem cells, she needs to feed them food. She needs to feed them nutrients. So it is how she started to formulate CellAge Plus with Dr. Mark. So who is Dr. Mark? Dr. Mark has been practicing holistic integrative nutrition for over 30 years. He doesn't encourage curing diseases by using drugs. He would prefer using natural therapy, natural food to remain healthy, or even to prevent diseases. Okay, here come to the recommendation for the program. Okay, our researcher, our formulator would recommend you if you are healthy, if you have healthy condition. Okay, so they would recommend you to go for a 3 months program. Okay, 3 months program is good enough for you to activate your stem cell in your body and to produce more stem cell for your body. Okay, if you don't have perfect health condition, okay, you can choose to go for 6 months program, because 6 months program is able to help you first to activate to awaken your stem cells in your body, and then proliferate, meaning to produce more stem cell for your body, and again to regenerate, okay, to repair your body cells. Okay, today we are talking about Omicron, we are talking about immune system. So if you go for 6 months program, you will be able to build up a better immune system for your body, to build up good quantity and a good quality immune cells for your body. So for more details about the package, can refer to our business partner or business team. Yeah. So here the end for my sharing today. Hope is life and life is hope. Okay, I would encourage everybody to stay healthy, to stay safe.